Greetings, I am Nurellya Faqhiraah binti Aziz, a postgrad student from University Kebangsaan Malaysia, and I would like to present our study on S-Allylcysteine limits cardiovascular injury induced by isoprenaline in ovariectomized rats. Did you know, apart from getting trouble to fall asleep, constant joint pain and hot flashes, postmenopausal women are also facing with increased risk of getting cardiovascular disease, more so those with comorbidities. Hormone replacement therapy has been shown to have unwanted side effects. But fret not, here is a promising result for all of them. An active compound found in each garlic extraction called S-Allylcysteine has been studied to regulate mitochondrial survivability, hence leading to better cell survivability. It also reduces oxidative stress and cell injury, modulates the hypertension culprit as all of us know is called as ACE81 axis. Lastly, it also limits cardiac hypertrophy and fibrosis. This cardioprotective mechanism have been studied to be majorly contributed by the cystione gamma-lyase hydrogen sulfide gas axis. So this gas so transmitted doesn't only facilitate with the vasodilation, but also helps with the transcription of antioxidant. So, the aim of our study is to investigate the effects of S-Allylcysteine on ovariectomized rats with myocardial injury. To mimic the postmenopausal condition among humans with the depletion of circulating estrogen, the female rats were initially surgically ovariectomized followed by 3 weeks of recovery. Then, the rats were injected with isoprenaline subcutaneous injection with the dose of 85 mg/kg twice with the 24 hours interval. After that, the rats received oral gavage treatment of either SAC with the dose of 100 mg/kg or distilled water for 7 days. Finally, the rats were sacrificed and the hearts were cannulated by the Lagendorf isolated perfuse system for cardiac function measurement. Throughout the experiment, blood pressure and electrocardiogram were monitored, and blood were withdrawn for estradiol and troponin T measurement. To evaluate the success of the ovariectomy surgery, uterine was weighed and serum estrogen were measured. Uterine weight is seen to be reduced in all of the groups except for sham, while as for the serum estrogen, it seemed to have a pattern of decrease among the OVX group compared to the non-OVX group. This is because uterine atrophy happens is because of the depletion of circulating estrogen that happens after the ovariectomy surgery. Before jumping to the validation of myocardial injury induction, here is ways to interpret the electrocardiogram result. The most important highlight here is the QRS, which represents the ventricular contraction, and it ends as the T recovers to the straight line, which is called as the isoelectric point. The result here shows that the RR interval and QRS interval is reduced compared to the non-MI, meanwhile it is increased compared to the non-MI and QT interval. These are the effects of isoprenaline in increasing conductivity and contractility, hence shortening between one cycle of ventricular contraction to another, and lengthening the relaxation as a result of positive lucitropic effect of isoprenaline. The increased serum troponin T in MI group right here shows that it could be increased due to its release because of the cell injury caused by isoprenaline. In oxidative stress study, only glutathione showed a significant increase in ovariectomized with MI group supplied with SAC, showing that SAC might have exerted its effect on increasing antioxidant level that might have been possibly through the mechanism of cystione gamma-lyase as formerly mentioned before, an enzyme that catalyzes the production of endogenous hydrogen sulfide gas that lead to increase of antioxidant release. As we studied, only a pattern of increase is seen in CSE activity level in those hearts supplied with SAC. However, no alteration is seen in malondialdehyde levels at all, that is an oxidant product. As for cardiac function, no alteration is seen in left ventricular developed pressure and maximum contraction rate, although systolic blood pressure shows a reduction after receiving 1 week of SAC treatment in OS group right here. This is probably through the mechanism of SAC ability in modulating the ACE81 axis, hence preventing the increase in blood pressure. We also did picroserous red staining to detect the collagen deposition. Clearly, the MI-induced heart shows a prominent pink staining heart that represents the collagen deposition. This is because isoprenaline causes cell death, and this collagen deposition acts as a compensatory mechanism of the heart to maintain its elasticity and integrity. In SAC-supplied hearts, the collagen deposition are seen to be controlled, which is good because excessive collagen deposition indicates poor prognosis after myocardial injury. As to summarize my whole study, SAC from this cardiac extraction has shown to increase the antioxidant level, regulate the blood pressure, limit cell injury and fibrosis in overectomized rats with myocardial injury. So, as to conclude everything, SEC may have limited injury induced by the isoprenaline, but more molecular study is warranted to confirm its mechanism in cardioprotection. May it be because of the cystionic gamma lyase and hydrogen sulfide? Alright, that would be all from me. Thank you. Stay home and stay safe.